The next doctor that I would like to introduce today is Dr. Zhou. She is joining us directly from her province in China. Dr. Zhou is actually a prominent research project leader in mainland China. She has presided over 6 provincial and municipal scientific research projects related to reproduction and genetics. Now, the doctor works for the Hainan province Maternal and Children's Hospital in mainland China. So let's welcome Dr. Zhou. Hello, doctor. Are you with us?
Yes, I can hear you. Let's begin. My topic is endometrial in Chinese rape patients. We all know that there are 2 parts of factors contribute to a successful pregnancy, the seed and the soil. For the seed, embryo factors include ovum quality, sperm quality, embryo morphology, chromosomal euploidy, and pellucidar. The soil endometrial factors include anatomy of the uterus, endometrial lesion, endometrial receptivity, and immunoregulation and endocrine. We all know that endometrium plays an important role in reproduction, like the endometrial microbiota, maternal embryonic crosstalk, and endometrial receptivity, and also destilation. The endometrium is receptive when it is ready for embryo implantation to occur. We call it endometrial receptivity. The period of receptivity is called the window of implantation, WOI, and successful implantation requires synchrony between the embryo and a receptive maternal environment. The proliferative, early secretory, mid-secretory, and late secretory have different expression patterns. So the scholars found the specific gene cluster expression patterns in the period of proliferation, pre-receptive, receptive, and the post-receptive periods. Let's take a look at endometrial myobiota. Although the vagina has long been known to contain microbes, the uterine cavity was classically considered a sterile organ. A report challenging this dogma suggested the existence of an endometrial myobiota comprising different microorganisms. Presence of bacterial pathogens in the uterine cavity may cause chronic endometritis and poor clinical outcomes, including implantation failure, miscarriage, premature birth, and neonatal infection. No abundance of endometrial lactobacillus is associated with poor reproductive IVF outcomes. So we use EndomeTRIO to detect endometrial factors. It's a set of tests, include ERA, stands for endometrial receptivity analysis, to define personalized window of implantation, and EMA, endometrial microbiome, metagenomic analysis to analyze percentages of lactobacillus and pathogens. And also ALICE stands for analysis of infectious chronic endometritis to detect the CE pathogens. We see ERA is a molecular tool that determines the receptivity status of the endometrium. It defines the best day for embryo transfer. That is the personalized embryo transfer, PET. For example, if we detect on the progesterone plus 5 day, we detect the pre-receptive, 2 days pre-receptive. So we can postpone the embryo transfer for 2 days to the receptive period. And when we detect on the progesterone plus 5 day, the result is 1 day post-receptive. We can bring the embryo transfer forward to progesterone plus 4 day. Let's take a look at the EMMA and ALICE. EMMA stands for the Endometrial Microbin Metagenomic analysis. It's screening test to evaluate the endometrium at the microbiological level to help to improve clinical management of infertile patients. It can determine the percentage of lactobacilli and dysbiotic bacteria present in the endometrium to improve the patient's reproductive prognosis. And low proportion of lactobacilli are associated with poor reproductive outcome in assisted reproduction patients. The EMMA test include ALICE. ALICE stands for analysis of infectious chronic endometritis. It's diagnostic test to detect bacteria causing chronic endometritis, CE. We can see it can detect specific bacteria like the Enterococcus, Streptococcus, Staphylococcus, and Mycoplasma, Chlamydia, and Neisseria. These are the PET outcomes in receptive and non-receptive patients. In Spain, this study showed us the pregnancy rate can reach total to 70.9%, and the ongoing pregnancy rate for PET can reach nearly 60%. And in USA, this study used both PGTA and ERA for PET. The clinical pregnancy rate can go to more than 70%, and the live birth and ongoing pregnancy rate can reach more than 50%. And in China, the cumulative pregnancy rate in PET can reach 74.63%, nearly 10% higher than FET group. and the pregnancy rate much higher, almost 30% higher than the FDT group. And in Japan, the pregnancy rate per patient and pregnancy rate per transfer is much higher than the control group in the PET group. This slide shows the Emma and Alice in RIF patients. Clinical pregnancy rate and ongoing pregnancy rate are significantly higher in the patients with Emma and Alice. We see there are two groups. The study group using Emma and Alice conclude 107 patients, and the control group without these two tests include 51 patients. In the age, BMI, duration of infertility, the history of delivery, and the miscarriage, also the mean number of previous ET cycle, are almost the same with the two groups. In this chart, we see the clinical pregnancy rate and the ongoing pregnancy rate are much higher in Emma and Alice group. In our center, we recruit 42 patients to perform endometrial tests. You can see in the Emma results shows 14 patients are normal, and 9 patients are abnormal, and 8 mild dysbiosis, and 11 ultra low biomass. In the ERA, we can see about 24 patients are receptive, and 5 patients early receptive, 12 pre-receptive 1 day, and only 1 pre-receptive 2 days. There are 25 RIF patients performed PET in our center. You can see in the first attempt, 25 patients, their average age is over 35 years old, and the implantation rate is 48.65%, and clinical pregnancy rate is 56%. And in 2 patients had a second attempt. 1 got a clinical pregnancy, and totally the cumulative clinical pregnancy rate is 60%. These are the results of WOI. You can see 18 patients have displaced WOI, and 11 of them performed PET. Most of them are receptive, about 57%, and 29% is pre-receptive 1 day, and 12% early receptive, and only 2% pre-receptive 2 days. The patient's average age is 36.5, and the implantation rate only 35.29%. The clinical pregnancy rate 36.36%. These are the non-lactal ballot dominant microbiome. we can see 33% are normal and 22% abnormal and 26% ultra low biomass and 19% mild dysbiosis. In these patients, the average age is almost 35 and the implantation rate 52%. The clinical pregnancy rate 68.75%. There are 9 patients have displaced WOI and NLDM microbin profile. 6 of them performed PET and 3 got pregnant. The pregnancy rate is 50%. We prepared 2 cases. One case, Miss C, 35 years old, and Mr. Huang, 36 years old. Primary infertility for 8 years. Menstruation is regular. ART was performed due to female tubular factors. After her first oocyte retrieval cycles, 1 fresh ET and 1 FET was performed, and 3 high-quality embryos were transferred in these 2 cycles, but didn't got pregnant. Then she performed EndomeTRIO test. The ERA results, pre-receptive 1 day, and the personalized embryo transfer PET of 1 blastocyst should be performed with 140 plus and minus 3 hours of the progesterone administration. That is 1 day later than the time at which this endometrial biopsy was performed. And the EMA result shows abnormal endometrial DNA from bacterial pathogens of the reproductive tract has been detected in a significant amount in the endometrial sample. And it shows negative for bacterial pathogens causing chronic endometritis. So in December 2021, after amoxicillin and clavulanic acid treatment for 7 days, followed by probiotic treatment, according to EMA report, 2 blastocysts were transferred at plus 140 hours, according. So we continue the case 2. 39 years old woman and 41 years old man. Primary infertility for 6 years, for 8 years. Menstruation is regular. 1 IUI cycle was performed due to female tubular factors and DOR, but no pregnancy. Then after 4 times of oocyte retrieval, 4 fresh ET and 2 FET cycles were performed. Totally 10 high-quality embryos were transferred in these 6 cycles, but didn't got pregnant. Hysteroscopy was performed in 2018. The pathology showed endometritis, and we applied anti-inflammatory treatment. In August 2021, she performed endometrial test. The ERA result is receptive, and the EMA result showed abnormal endometrial microbin. DNA from bacterial pathogens of the reproductive tract has been detected in significant amount in the endometrial sample. and is positive for bacterial pathogens causing chronic endometritis. So we treat her with the metronidazole for 7 days, followed by probiotic treatment according to EMA report. And we transferred 2 day 3 embryos at progesterone plus 72 hours according to ERA report. Finally, she got positive beta HCG. And now current pregnancy is 17 plus weeks. And these are her ultrasound results at 6 plus weeks and the normal NT reports. So we got our conclusion. 56% RIF patients got pregnant after their first transfer based on the endometrial test results. Cumulative clinical pregnancy rate seem also improved with the consist PET. 88.1% patients have at least one abnormality. So perform endometrial will be more effective than conducting single test alone. After targeted antibiotics treatment, 68.75% patients got pregnant. Endometrial microbiome, including pathogens and probiotics, may have a greater impact on reproductive outcomes than our traditional understanding. The average age of patients with displaced WOI is more senior, which could lead to the relatively lower pregnancy rate than in control group. So if we use both PGTA and the endometrial tests, we may got better results. Sample size is small. We plan to continue using endometrial for more applicable RIF patients to verify the clinical value. That's all for my presentation. Thank you.
Thank you, Dr. Zhou, for joining us. Apologies for the technical issues. And we will not be having the Q&A now because we are a bit tight on time. Okay, so we will move on to our next speaker,